Welcome to the press briefing on COVID-19. Present today, we have Professor Sophia Chan, Secretary for Food and Health, Mr. Joseph Leung, Director of Fire Services, Dr. Ronald Lam, Director of Health, Dr. Edward Choi, Controller Secretary for Controller for Health Protection, Dr. Tony Ko, CEO of the HA, and Dr. Liu Kai-hin, Chief Manager Q&C of HA. So the Secretary will give us an opening address, and then the speakers will speak on respective areas. Now, because of the epidemic, please observe social distancing. Dr. Sophia Chan. Friends from the media, fellow citizens, we're in a very dire situation since the 23rd of June 2020, when we had the first case. As at yesterday, that is the 25th of February 2022, we have cumulatively 96,056 cases. The fifth wave of outbreak, which started on the 31st of December 2021, has accumulated 81,425 cases in total, accounting for over 86% of the total number of cases in Hong Kong. Now, the scale of the current wave of outbreak is unprecedented, and the peak has yet to arrive. And so all sectors of the community must face up to the threats posed by the epidemic. Because the Omicron variant is extremely transmissible and expeditious. And we also have the Delta strain being transmitted in Hong Kong. So the growth of cases in the fifth wave have been very expeditious. On the 31st of December 2021, we had only 19 new confirmed cases. As at yesterday, we had 10,010 cases. In less than 2 months, the number of cases has grown geometrically, and these have brought unprecedented challenges to our healthcare system. As announced by the Chief Executive on the 22nd of February, the SAR government has been mainly responsible for the fight against the epidemic, and under the staunch support of the central government, we have adhered to the policy of stopping or preventing importation of disease and spreading of the virus in Hong Kong, and a multi-pronged approach to intercept transmission chains so that we can have early identification, early isolation, early treatment. And we must adhere to the dynamic zero infection policy, and we should make use of the coming couple of months, which is critical in carrying out a whole package of measures to stabilize the epidemic. And I'd like to set out what the Bureau has been doing in the past few days. Now, because the number of cases has been growing geometrically, now we would like to talk about measures for early identification and isolation and treatment in hospitals. First, we insist on early identification and isolation to intercept the transmission chains. As far as early identification is concerned, we are gradually growing in our testing capacity. However, the demand for testing is also growing day by day, and we're under extreme pressure when it comes to testing work. Most of the cases have yet to be confirmed. Some members of the public, including those who were tested positive by RAT, may have to wait for many days yet to receive their testing results, and naturally they feel anxious, and this is far from desirable. In view of this, in view of the current risk evaluation and test update, our priorities in testing and the mode because we face rather high risks of infection, and although the sensitivity of RAT is a bit inferior to that of nucleic acid test, they can relatively able to identify patients with higher viral load, and they can be used in a large extent and can be self-administered, and they're also convenient to use. So the advantages of RAT. given the current emergency, RATs are very important, and information with regard to RAT, including how to choose the right RAT kits and the actual methodology in using the kits and the government's distribution arrangement, etc., please refer to our thematic website. In fact, the Food and Health Bureau, the EPD, and the HAD have always adhered to the results of sewage surveillance. Together with property management agencies and district organizations, we are handing out over 1.3 million RAT kits to respective buildings and cleansing workers and property management staff. And this is a very popular move. It's been helpful in identifying potential infection cases. In the past 2 weeks, members of the public are very used to how to administer RAT for themselves. With the great support of the central government, the SL government has procured a large amount of RAT kits. The government has decided to adopt a risk-based testing strategy. So yesterday we reviewed our strategy as follows until further notice. First, the government will continue to target at higher risk buildings, will continue to conduct restriction and testing declaration operations, and we plan to cover more buildings. So we're going to cover more buildings in our RTD operations, and the follow-up action will be followed by RATs administered by residents themselves. This will remove long queues and will also be speedier. Now, for places of higher infection risks, such as building and catering premises, recording multiple cases, etc., the government will distribute RAT kits to relevant persons to replace previous compulsory testing notices. In other words, relevant persons no longer need to conduct tests at community testing centers or mobile testing or mobile specimen collection stations. They may conduct RAT on their own. The CTNs which have already been issued will be cancelled. The government will continue to distribute RAT kits to residents, cleansing workers, and property management staff in relevant districts where positive results are detected in sewage surveillance.
And fourthly, for specific groups of practitioners who are exposed to higher risk, including those working in quarantine hotels, and airport staff, those working in container terminals and cold storages. Compulsory testing will now have to be taken. At the moment, they will need to be taken by such persons once every 2 or 3 days to once every 7 days. At the same time, through the trade, we will be dispatching the RAT kits to the practitioners so that during the testing cycle, they will be able to administer more rapid tests. Other than continuing to provide service for those who need to be subject to compulsory testing, the government will continue to maintain the operations of the community testing center and the mobile sample collection center to provide free testing service for those who need the service in order to minimize the transmission of the virus in the community. Furthermore, people who have been tested positive through RAT, in the past they have to submit further samples such as the deep throat saliva for nucleic acid tests to confirm the results. In order to avoid duplication of resources and delay, the government will now plan to allow those who have taken the RAT to register the positive test results online, so that they don't need to be further confirmed through the PCR test, and they will be regarded as positive cases for follow-up. And this will help to speed up our support for those people who have been tested positive. So this we'll proceed with this soon, expediently. Next, early isolation. The hospital authority is now trying very hard to enable people who have a higher risk to be sent to the hospital. For those who don't have any symptoms or who have mild symptoms and are infected, we will do our best to send them to the community isolation facilities. Starting from Monday, the 21st of February, for persons pending admission to hospitals or isolation facilities, we are providing them with additional support. You might have heard the report that we are gradually, giving them, anti-epidemic resource kits and electronic bracelets to give them, to help, to provide them with health monitoring disease, and so that they will be able to protect their health while they are staying at home. While they are waiting at home, if they have any medical needs, such persons can call the hotline of the hospital authority. They can also use the service of the designated clinics of the HA. The number of such clinics have now been increased from 7 to 9. And for those people who are seeing mild symptoms like cough and sore throats, they will be able to receive treatment and diagnosis. At the same time, the Department of Health, starting from the 8th of February, have implemented a scheme of staying home to fight the epidemic. This is so for people who are deemed to be, suitable close contacts, and also the household contacts of close contacts, to go through a 14-day and plus 4-day home quarantine. We will take into consideration the home environment, their physical state, and the risk, exposed to those people who live with them. And the plan is proceeding smoothly. The latest number is that 16,000 people are now already subject to home quarantine, of which 5,870 people have already completed their quarantine. For those people who go into the quarantine facilities, or those who receive the close contacts of those receiving home quarantine, they will need to go to the community facility, isolation facility, or for a 14-day medical surveillance. After a new round of risk assessment, if such people already received two doses of the vaccine, they can on day 6 and 7 take the RAT test. And if for 2 consecutive days they are tested negative, it would show that they have a very minimal level of transmission, and therefore they can be allowed to leave the community isolation facility or home quarantine. Further details will be announced later. Secondly, in our effort to control the epidemic, we will insist on treatment, but we need to have a triage facility for our medical facilities, and we will focus on reducing the number of serious cases and fatalities. I think we all understand that the facilities of our hospital authority is limited, and therefore we must provide treatment at various levels so that people with different degrees of the infection will get the appropriate treatment. Although compared with other mutant strains, the Omicron variant, I think you've learned from the HA announcement that the symptoms of this strain is milder. But recently we have seen some elderly and young children who have died because of the infection, and this is a worrying trend. The HA is now making the optimal use of all the public hospitals, including the North Lander Hospital and the Hong Kong Infection Control Center, and also the community treatment facility at the AWE, to admit the patients affected by the coronavirus. So for the different categories of cases admitted to the hospital, the HA will make a professional judgment regarding the discharge criteria. The clinician will make a clinical judgment based on the risk level. The doctor can make a clinical assessment. If the condition of the patient is stable, and if his home condition or the elderly home condition permits, or if there are other alternative community isolation facilities available, the patient can be allowed to be discharged and go back home or to other appropriate facilities to rest until day 14, when they are tested negative. at which time it will be safe for them to leave the home or the facility. For these patients who are discharged, after they have been tested positive, normally they will obtain a negative result on day 14 and will be able to leave the home and lead normal lives. I think this arrangement can expedite the turnover of our hospital beds so that we can make more optimal use of our hospital resources. At the moment, a large number of people are going to the public hospital for treatment, many of whom are elderly persons. In order for those people who are elderly who are waiting for admission and ensure that they have the proper care, we have in Choi Wing Road, in the sports complex in Kwun Tong, we have set up a temporary admission facility to admit elderly patients referred to them by the HA in order to prevent another surge of elderly people going to the A&E ward or public hospitals and have to stay outdoor in tents outside the A&E ward or public hospitals. We would definitely not allow that to happen again. The temporary holding center for the elderly, the center will be open in the Shek Kip Mei playground. Thirdly, I think to prevent, import and local transmission, we have recently also tightened our social distancing measures in order to reduce human traffic and to prevent transmission. All these social distancing measures will be maintained for another until the 20th of April. Premises which have been closed will stay closed. The number of gatherings of persons will be limited to 2. We are banning people to have gatherings involving more than members of 2 households, and there are also requirements regarding masking. Regarding the masking requirements on public transport and on the MTR trains, persons are required to put a mask and not allowed to eat. So all these requirements have already been added. But still, we hope that members of the public we would like to make a special appeal here. In a while, the director of the CHP will announce the number of confirmed cases, and you would notice that there is many transmission chains in our community, and therefore all of us will have to do our level best to stay home to fight the epidemic. Of course, sometimes it is necessary that we need to provide some services. People need to go to work. That is inevitable. Besides that, I would like to solemnly appeal to the public to stay home to fight the epidemic. If you cannot stay home and you need to go out to do errands or to do your shopping, I hope that you can minimize the number of people doing that. Instead of several people, one person could do the job. And secondly, cut down the time. Originally, you may plan to spend a few hours or an hour doing that. You may want to consider whether you can cut short the time. Thirdly, cut down the frequency. Instead of going on these errands for several times, you can do it, at once. Fourthly, vaccination. We need to step up our effort to enhance the vaccination rate in Hong Kong. Earlier, we have announced the vaccine pass arrangement, which was implemented since the 24th of February. The government has been steadily increasing the vaccination volume so that people will be able to get vaccinated more quickly. We expect that the daily vaccination rate by the end of the month would exceed 85,000. Starting from mid-February, we've already added 10 additional vaccination facilities. We've mobilized more than 1,000 private clinics to help us enhance the vaccination rate. We're also helping community groups to carry out outreach activities. The 23 vaccination stations in hospitals will extend the operating hours starting today. They will operate from Monday to Saturday, and members of the public are welcome to get vaccinated there. I really like to appeal to the general public to get vaccinated ASAP to protect themselves and their family members, and also to minimize the risk of complications once they become infected.
Yesterday, the joint committees of the Center for Health Protection gave some new recommendations on vaccination. They recommended new measures to facilitate vaccination and to enhance the effectiveness of vaccines. There are 4 points in the main. First, those who are over 60, the duration between the second and third doses will be reduced from 6 months to 3 months. For those who are between 5 and 17, that is adolescents, the first 2 doses, the gap between the 2 doses can be shortened from 12 to 8 weeks, and injection should be done at the anterior lateral aspect of their thigh. That is to shorten the time gap between the second and the third dose. And the third recommendation cover adolescents aged between 12 and 17. Now, they can now have their third dose for CoronaVac and Comirnaty. The duration between the second and third jabs may be different. One is 5 months and another is 3 months. Still, they can now have their third dose, and for immunocompromised persons, they can now have 4 doses. For those under 12 and over 12, there are some differences. You may refer to our press release for details. All right. After vaccination, I'd like to remind the public that will continue to prevent importation of the virus by means of boundary control. On the 22nd of February, the government announced that 9 places, i.e. Australia, Canada, France, India, Nepal, Pakistan, the Philippines, the UK, and the US will continue to be subject to flight suspension, and the measure will be extended from the 4th of March to the 20th of April. Now, for civilian flights from these 9 places, only those who have not stayed there for 14 days are allowed to land in Hong Kong, and they're not allowed to land in Hong Kong through transit. And this will greatly reduce the number of possible cases from these places, because they can bring tremendous pressure on our healthcare system. Because previously, although we asked for negative results of tests before boarding, many of them became confirmed on arrival. So they have been consuming our healthcare resources. Third, the flight suspension mechanism. We tightened the relevant measure on the 20th of December last year, and so far 48 flights have been banned from landing in Hong Kong to intercept the importation of cases in Hong Kong. I'm most grateful to the central authorities for sending experts to Hong Kong in the past week, together with the SR government officers and also HA personnel. There have been a lot of exchanges, and we have epidemiological experts and also the treatment task force, and they have given us very valuable experience in fighting the epidemic. I am responsible for the task force on epidemiological experts, and together with the Department of Health, HA, and local experts, we exchange views with mainland experts, and we're now following up on some of the recommendations, such as the information platform just announced not long ago, and also online information platform that was set up on the suggestion of these experts. They will enable the Department of Health to arrange early isolation and treatment for confirmed cases and to trace contacts, close contacts. I'm grateful to the country for donation of proprietary Chinese medicine to us. We're now distributing such medicine to those who are subject to isolation at penny-based center, and then we'll continue to distribute these proprietary Chinese medicine through various channels to help fight the disease. Faced with these challenges, the Bureau and government departments and other bureaus will unite and stand united to fight the epidemic together. I'm most grateful to different sectors of the community, in particular our frontline healthcare personnel, whether they work for the HA or for private hospitals and in private medical organizations, and our Chinese medical practitioner sector, and also our 2 university medicine school. They have contributed a lot to our fight of the epidemic, and I appeal to the public to cooperate with us, because even if we have excellent measures and facilities, we need the support and collaboration of the public in order to fight the epidemic. While we're in a very difficult period, I'm sure that with concerted efforts, we're able to win this war against the epidemic, and then we'll triumph, and then life will be brought back to the right track. Thank you. Mr. Leung, Mr. Joseph Leung, Director of Fire Services. Thank you. Good afternoon. Now we're in a very dire situation. I appeal to the public to reserve very valuable A&E services, ambulance services, and hospital beds to the really serious cases. Now, at this time, 5 p.m., we should have around 260 ambulances available for service. But now we've only got 182. We are 30%. We have 30% less, or 80 ambulances, because as at this morning, 268 officers of FST are confirmed, and 400 officers are close contacts, and therefore they cannot be on duty. So our manpower is very tight. And in dealing with COVID cases, we spend 2 to 3 times more time to handle these cases, and as a result, the turnover time of ambulances is much lower, and we were only able to fulfill our performance pledge in 23% in the past few days. So for every 4 cases, only 1 we can honor our performance pledge. Just at 4 p.m. today at our communications center, we have got 650 cases waiting for ambulances. The longest waiting time has been over 26 hours, and we're still not able to deploy an ambulance to the caller. In other words, there may be the possibility that some serious or critically ill patient cannot get any ambulance service, and services or treatment may be delayed. So for members of the public with no symptoms or very mild symptoms, please do not call an ambulance or go to our A&E departments, because given the current situation, you're not going to be admitted even at our A&E department. Very valuable life-saving resources should be reserved for really critical cases with urgent need for medical treatment. Thank you. Mr. Choi. I'd like to report to you the latest cases. For the whole day on the 25th, yesterday, we have received 17,063 reported cases, and that is the number of confirmed cases. 5,034 cases were reported by the HA directly. 2,236 were confirmed by our public health laboratory of Department of Health. For the remaining 9,793, they were reported either by private labs or by private members of the public. So in total, we have 17,063 for the from 22nd, we had 7,900 cases, and the next day 17,269, and 24th 21,978, and 25th 17,063. So the numbers have been high. So we have close to about 17,000 to 20,000 cases per day. From our public health laboratory, among the 2,036 cases, 92% of them were Omicron cases, or L452R samples. About 8% being analyzed, and the viral load is so low that we cannot confirm the variant. We've got one case of L452R, which is Delta. So from our laboratory data, most of the cases are Omicron cases, and they are mainly Omicron BA2, which is more transmissible case variant, so you have to note this. Among the 17,063 cases yesterday, 6 were imported. Most of them identified either at the airport or in hotels. For the remaining 17,057 cases, they are local. We still worry about infection in RCHEs. We received 50 reported cases yesterday, either episodic cases or clusters. So far, 470 RCHEs, a total of 1,943 residents, and over 600 staff members have been infected. Now, 70 RCHEs have major outbreaks. So in RCHEs, we have to continue to advise all elderly residents to be vaccinated. For those who have not received the first jab, they should do so as soon as possible. And we hope that family members can support this early vaccination measure. For those who have taken the second jab, we suggest that they take the third jab as soon as possible. The Joint Scientific Committees yesterday shortened the time duration between the second and the third jabs, so as to enhance the vaccination coverage of residents and the defense as soon as possible. As said by the Secretary, in the community, we hope we can have more respite centers, and our discharge criteria have been adjusted so that given the limited healthcare resources available, we can provide the most appropriate treatment for elderly homes residents as soon as possible.
As of yesterday, the total number of cases during the 5th wave, we have a total of 126,000 odd confirmed cases. In our information platform, we have received 77,000 pieces of information supplied to us by the public. We're grateful for sending us the information which can help us speed up our tracking, and that we'll be able to provide you with the latest information as soon as possible. Next, Dr. Lau. We have 9,485 patients staying in public hospitals, North Atlanta Hospital, the Infection Control Center, and the AWE Community Treatment Facility. Yesterday, we had about 800 patients who have already had quarantine or the discharge. So we now have 550 patients receiving treatment, and we have more than 500 in the Chuen Wan, Dorset Hotel being quarantined there. Last night, we have reported 40 patients who are in critical conditions and 97 in serious conditions. As of midnight, 0 hour this morning, in the last 24 hours, we still have 66 patients who have been infected by the virus who have passed away. There are 39 male and 27 female, age ranging from 19 to 101. Amongst the 66 people who have passed away, 60%, or about 39 of such patients stayed in elderly care homes. Those who have taken 2 shots of the vaccine, there were 4. There were 4 who have taken 1 shot. So altogether, 8 patients have taken 1 jab or more. So in other words, those of the people who passed away today, I think only 10% of them have taken the vaccine. For those elderly persons over 65, there were 61, more than 90%. For the remainder, the 5 remaining patients who are younger than 65, 3 of them stay in hostels or elderly care homes or RCG. There is a 19-year-old person who actually is a victim of a chronic disease, staying in a home and receiving different types of treatment. We have another 41-year-old case who also suffer from a chronic hereditary disease and who's been staying in a home. The other patients also suffer from chronic diseases like stroke and cancer. Because of the time lag, today we are reporting the cases between the 22nd and 24th of February. We have another 22 fatalities which we have not reported earlier. They include 15 male and 7 female. During the 5th wave, we have a total of 402 persons who have died in public hospitals, most of them elderly persons. 607 people so far have passed away in public hospitals since the outbreak of the epidemic. For the last 2 days, we have 293 people who have been discharged. The total number of isolation beds and utilization rate is 97%. That is already the upper limit. And also, during the screening upon admission, we found more than 40 patients who have been confirmed to confirmed cases, and we have 90 people who are close contacts. So far, we have 2,322 patients of the HA staff who have been confirmed. We now have enhanced our discharge criteria. Like the Secretary said, starting from today, we have changed our discharge criteria for patients in public hospitals. If the doctors could clinically, conclude that the patients have recovered and is in stable condition and suitable for discharge, and having considered their home environment, then we will arrange for them to be discharged. However, after the discharge, they still need to stay home until the 14th day before they can leave their home. I hope you understand that every day we have a large number of confirmed cases, many of whom are waiting for hospital admission. And the viral load, many of them, the viral load is very high. We need to, make available the hospital beds to admit the priority patients. This is an emergency situation, and this is the most expedient way. Otherwise, we will not be able to make available beds for those patients with the greatest need. We hope that patients who have been discharged and who are staying at home, they will stay isolated. They need to strictly observe the anti-epidemic measures, avoid staying out, and maintain social distancing. The experts have discussed these criteria and have agreed with the Department of Health on these criteria. Next, I'd like to talk about the arrangements regarding the designated clinics. Starting from February 24th, we have opened up 9 designated clinics. The utilization rate has been steadily rising. Going forward, we will be conducting more testing, and more patients may need to go to these designated clinics. The arrangement now is that on March the 1st, we will open up 5 additional such clinics and another 3 on the 7th. So altogether, there will be 17 such designated clinics spread out throughout the territory. We hope to be able to provide about 3,000 places every day for those who need patients who have the need can make telephone bookings. So we will, announce further details in due course.
Q&A. Can you please ask no more than 3 questions each time, and then identify the organization you represent. The lady in a white jacket. I'm from Now TV. Good afternoon. I'd like to ask about the positive RAT test. I'd like to know whether this measure will take effect now, or do we have to wait until the platform is ready? Now, after people have registered with the platform, will the patient be considered a confirmed case right from that moment? And so long as he has been tested negative, he can leave home. And as for RTD, you're also using rapid tests now. In the past, people with an SMS indicating negative can leave. With this new arrangement, how can you confirm that the resident has been tested? And some employers require certification from the government before leave can be granted. With this change in measure, does that mean that when an employer sees a positive result in a rapid test, sick leave can be granted? Now, for close contacts, he may leave home after the 6th and the 7th day. When is the when should he start counting? Secretary. All right, I will take these questions first, and let's see if the Director of Health has anything to add. As regards rapid tests, we are planning to regard rapid test with positive result, a confirmed positive case. I've said that we're planning to do that, and then we'll have a platform. The platform will allow members of the public to report. So we are dealing with the reporting platform in full steam. The most important thing now is, now if you have used a rapid test with a positive result, you might have already got a deep throat saliva sample bottle. That's perfectly okay. You can continue to do this. But if you are tested positive with a rapid test, the most important thing for you is to stay home. This is important. And secondly, in addition to staying home, you should note your own health conditions. If you're asymptomatic, you should stay home and isolate yourself. If you have mild symptoms, you can make use of our current hotline or designated clinic. But if you have some warning signs such as a shortness of breath or chest pain, etc., then you should be admitted for treatment. So you should take care of your own conditions, and that's most important. As regards other details, perhaps Dr. Lam can supplement. Now let me stress that for RTD, we will continue to use nucleic acid test for testing. I was only referring to a CTN. For instance, if for a certain building after epidemiological survey, a certain person has been to a certain place and he should be subject to CTN, we will use rapid test. If a certain we may also distribute rapid test kits in buildings and certain premises to reduce the need for queuing up and unnecessary risks. So for RTD, we'll continue to use nucleic acid test, but for CTN, rapid test will be administered. Dr. Ronald Lam. Now, rapid test is to test the antigen as the basis. Judging from overseas and our own experience, rapid test is quite good in terms of sensitivity, in particular when there are a large volume of cases in the community. The use of rapid tests can help us to identify positive cases very quickly. So self-administration of a rapid test can really help us to achieve early identification under our dynamic zero infection policy, because you can very quickly administer the rapid test on yourself. And once you have a positive result after a rapid test, when the platform is established, then you can report your situation and you will be regarded as a confirmed positive case. The handling will be the same as what we do for confirmed positive case now. The information will be uploaded to our database. So long as you have those data, then we can issue a certificate for applying for sick leave. We hope to set up the database or the platform as soon as possible. And as for intercepting the disease at high-risk places, we will continue to do that. In places where there are multiple cases, we will use RTD. We will administer nucleic acid tests to identify positive cases. And after that, we will follow up with rapid tests. This is an enhancement measure. It will help us to save the resources for doing nucleic acid tests, and it will also help us to identify positive cases. So it will be an ongoing measure. As for close contacts, can you please repeat your question? I didn't quite get it. For close contacts, they may leave after the 6th or the 7th day if the result is positive. I'd like to know when do you start counting, and do they need notification from the Department of Health? And if they're living with a confirmed case, do they have to wait until the confirmed case is also negative? Why do we have chosen the 6th and the 7th day? Because if the result is negative, using a rapid test for the 6th and the 7th day, the possibility of being infectious is low. So we would like to align with the current calculation method. Now, for currently, when there is a negative result from RAT, we require confirmation by means of a deep throat saliva sample or by means of a swab. And we use the date of submission of the sample or the nucleic acid test as the date of counting. And so details will be announced when the platform is ready for use. This lady in green. I'm from Commercial Radio. I've got 3 questions. The government is going to accept a positive RAT result for confirmation, but it said that a rapid test may not be as accurate as a nucleic acid test. Will this increase the risk of a false positive? And will this delay treatment for people who need it and hence overburden our healthcare system? Now, the CE said that there will be another 5,000 isolation units, but then that can never catch up with the growth in number of cases. And we can easily have a few hundred of positive cases identified in RTD. Now, if you can't isolate them, then you may be able to achieve early identification, but not early isolation. And I'd like to know, on average, how long does a case have to wait before they can be treated?
Now, thank you for the question. First of all, I'll talk about the isolation facility and the arrangement for RTD. Given the severe situation of the epidemic and the number of positive cases is so high, and we're still yet to see the peak. So we, in view, well, in the light of our facilities available, we need to serve the people with the most need. We need to adopt a triage arrangement. We need to make an assessment based on the needs of the patient and the risk. So this is important. So we are treating our patients and place them at different levels and decide on, and then we'll place them in respective facilities or stay at home. Other than this triage arrangement, we understand that there are some people who need to use some of the facilities. For people with the most need, of course, would be the would be the isolation beds in hospitals, whether it's the Tier 1, Tier 2, or the community treatment facilities. The community treatment facilities include premises like the AWE, which is a community treatment facilities. The North Lantau, Infection Control Center could be used as a hospital and a community treatment facility. At the third level, we are talking about our community isolation facilities. These isolation facilities like the Penny Bay facility or the hotels, and also soon we will be using public housing estate units to accommodate people who have mild symptoms or who are asymptomatic, and those who are younger in age who can take care of themselves, we will put them there. Also, at the present stage, our facilities are not able to cope with such a large number of cases. On the one hand, we will try our best to build these new facilities. Also, we have the support of the central government. Under the lead of the Development Bureau, different facilities are now being planned at the moment. But we also need to be realistic. We know that the majority of the people who don't have any symptoms, who don't have any serious symptoms, and if they are young, they're already, staying home. And we have a plan for these people who are confirmed and are staying at home. So including the triage arrangement. Now, if these people are totally asymptomatic, they can continue to stay at home, take the RAT test, monitor their own condition, and adopt medical surveillance. And there is also a hotline available if they have any queries. And also for persons with mild symptoms, people who may have a mild sore throat or a cough or a mild fever, then the HA. Now for such persons, there are designated clinics operated by the HA. We have designated hotlines for such persons to, for example, book designated taxis to take them to these designated clinics for diagnosis and treatment. And then the clinic will decide whether or not they need to be prescribed medicine. Thirdly, for the more serious cases, if you are waiting at home, you are infected, and there are warning signs like you are suffering from shortness of breath, or you are suffering from chest pain or stomach pain, or you feel dizzy and so on, then you will need to be admitted to hospitals. Well, in that case, so by dividing the patients into these different levels, like the Director of Fire Services said, if you're only a mild case, if you're not symptomatic, please don't dial 999 and go to the A&E ward. We really need to reserve the facilities there to serve those people who have the most need. Regarding the RTD, after the RTD, during the last few nights, for the confirmed cases we have identified, we have placed them to our community isolation facilities as soon as we could. We now have some hotels, because in we have the facility in Penny Bay. We also have the designated hotels, and such persons will be taken to these facilities. Of course, in future, well, I think we may be amending our testing strategy. We will be more focused. We will deal with the high-risk, cases as soon as possible. There will also be more RTD operations. The compulsory testing requirement, for example, for a single residential block, or if you've been to a premises for some time and it will be required to take, compulsory tests, we've changed that to RAT so that we can, shorten the queue and waiting time and minimize the overcrowding, and also to cut down on the backlog of, cases that need to be attended to. In order to be compatible with the early detection and early identification principle. The director also said earlier that at the moment we can use the RAT, which can, and therefore we don't require the patients to take the nucleic acid test for confirmation. This is because we have taken an overlook at the state of the epidemic and the overall level of risk. We also have looked at previous data. For example, we've now done many RATs. The accuracy of the RAT is very high at the moment. So if we have to really, battle the epidemic, we need to find out which are the best strategies that can help us, achieve early identification and early segregation. And this is exactly the measure that we are adopting. Third row, the gentleman in the blue shirt. I'm from TVB. The secretary said that the epidemic is getting more and more serious, but the government's anti-epidemic measures are not very well coordinated. We have a shortness of hospital beds and segregation facilities. You're asking people to quarantine at home, and the RTD is now changed to CTD is changed to RTD. So I think you seem to be backpedaling. So does it mean that during this fifth wave, the government has failed in its effort to fight the epidemic? Now that you have these new strategies to fight epidemic, it is similar to other countries like requiring home quarantine and replacing CTD with RT. Are you adopting these measures like other countries which are already abandoned the zero infection policy? Have you consulted the experts before you change your strategy to fight the epidemic? With this change of strategy, does it mean that the government is actually recognizing the RAT method? If people don't even need to take the PCR test, so with the support team from the mainland, what can they do? Will they only help us perform the comprehensive universal testing? And also there have been reports the government is now looking into the possibility of, allowing 2,000 health workers coming to Hong Kong and to help take care of the elderly and the elderly homes. What is the view of the Bureau regarding that report? And where would such persons be deployed to work? Who is going to make the coordination? And will they be adopting the method as they do in the mainland to save time? Now, first of all, I must clarify that at the moment, we still adopt an RTD strategy. We are aiming for early detection and early isolation and early treatment. In our strategy to intercept the epidemic, when we see that the number of cases are going up and that our isolation facilities are not sufficient, we need to have a triage, approach. And we need to adopt a targeted interception of the epidemic. Whether we are changing our strategy regarding testing, we are also adjusting our other strategies. They're all aimed at intercepting the epidemic. For early, we've adjusted our policy regarding early detection and also our testing strategy, and we are focusing our effort on the high-risk areas for cases with lower risk. I think we are fighting, against time. So we have nucleic acid tests in RAT, and we have chosen in some cases that we can adopt the RAT. The changes to our strategy does not mean that we've given up on interception. We are adopting a more targeted approach to intercept the transmission, and we will look at the overall situation of the epidemic and make a global, consideration. Secondly, I think different experts from mainland, whether they are epidemiological experts and experts in treatment, these two expert groups, whether it's the Department of Health or the HA, they both have very close exchanges with them. Later on, the Department of Health and HA can also give you more details. I think the current state of the epidemic is that there are two main points here. First of all, how can we effectively, provide, appropriate treatment at different levels? We have to step up our effort in this area, and that includes triage, and we need to be more systematic. And as for facilities, we need to speed up the construction of these facilities, and also how can we stop, mild cases to become more serious cases. In terms of treatment, this will be our focus areas.
Another important point is to contain the epidemic, how we can contain the epidemic, or at least slow down as it spread. Now, we have to be more focused and risk-based when it comes to early identification and conduct testing. And early treatment is just as important, and therefore that's why we have gone for rapid tests. Of course, to contain the epidemic, we must control crowd gathering, and that's why we have tightened our social distancing measures. And I said, if we must go out, we should reduce the frequency, the duration, and the number of persons going out together. So we are considering how we can administer the nucleic acid test in compulsory universal testing. We have been exchanging views with the mainland experts who have given us very valuable advice. As regards the Labour and Welfare Bureau's facilities, such as facilities at Fook Wing Road for the elderly who've been to A&E department but can't return to elderly care homes. Now we have a facility at Fook Wing Road, and later on there will be a sports center at Shek Kip Mei. They need large amounts of manpower, and the Labour and Welfare Bureau has been working on that. The Fook Wing Road facility can offer over 100 places, actually over 100 residents, elderly residents are already staying there. Poland Cook is helping in the day-to-day care, and the Medical School of Hong Kong U just announced yesterday that they will be there to help the residents medically and in patient care. So our idea is to provide relief to elderly persons who are stuck at A&E department or who cannot return to elderly care homes instantly. So we'll have more and more such facilities.
嗰邊第三行
The lady in brown jacket over there.
Question from SCMP. How many reported infections are there today? As the online system for rapid test results is not running yet, are people tested preliminary positive with rapid tests today counted as confirmed cases? And as COVID patients at public hospitals are allowed to be discharged based on the doctor's clinical observation, is there a minimum number of days required for them to stay in the hospitals before being discharged? And as there are videos online showing that patients are lying on stretchers set up on the floor in public hospitals, can you confirm that if this is true, and what will be done to improve the situation? Thank you.
Okay. May I invite Dr. Lam to answer the questions on rapid tests and Dr. Code on questions about the discharge criteria as well as the hospital situations?
Thank you for your question. First of all, the reason that we adopt the rapid antigen test instead of the gold standard PCR test are based on our real-world experience in adopting the use of RAT, rapid antigen test. So for the current measures, we are of the view that we have to allow the rapid antigen test to be used by those who are at threat or at risk of the COVID-19 infections. And for this, we can first of all save the precious resources for PCR tests. And on the other hand, because of the good performance in terms of sensitivity as well as specificity of RAT, we are confident that in view of the increasing prevalence of the COVID-19 infection in the community, it will have a better, what we call the positive predictive value, which in short is also reflecting a good performance to pick out those positive cases. So, but we need to develop an online system for those who tested positive using RAT, such that we can capture their information and their demographics in the system, so we can follow up with the subsequent measures, including distributing of the information packs and also align them and also include them into the admission systems based on the risk assessment. So in GIST, it will take us some time, perhaps a week or so, to have that online platform ready. And another measure that we introduced today is about the home quarantine cases, as well as those who are pending admission. As the Secretary for Food and Health had announced, those who have pending admission or are undergoing home quarantine, if on both day 6 and day 7 of their period of pending admission or during home quarantine, then if their RAT tested negative, then they could be released. As for the hospital, I would defer to Dr. Goh. Thanks.
Just before that, I just want to emphasize that is for the day 6 and day 7 RAT tested negative, that they can be released. That's for those who are vaccinated, okay? That those who have already completed 2 doses of vaccine.
The number of pardon?
The number of reported infections today.
Okay, I would defer to Dr. Choi. Yeah.
Thanks. So we report the cases as of yesterday. Yeah, yesterday. So yesterday on the 25th of February, there are 17,063 cases reported, including about 5,000 from Hospital Authority Direct, and 2,200 from our Public Health Laboratory Center of the Center for Health Protection, and about 9,700 directly from the private laboratory, and also including the community testing center. So in total, there are 17,063 cases reported yesterday.
Dr. Klo, please.
When our doctors and medical colleagues, when they consider whether a patient is suitable for discharge, they consider the overall clinical pictures. That is when a positive COVID patients, of course, in the hospital, we conduct a thorough assessment, a clinical assessment, look at the overall clinical pictures. If they consider the patient is relatively stable and ready for discharge, then they will arrange a discharge based on different criteria like the clinical conditions, the symptoms, investigations, among many other things. So we won't just rely on a single parameters, for example, the number of days to decide whether a patient is suitable for discharge. On the questions regarding the crowdedness in our accident emergency department, of course, as the Director of Health and Controller of CHP has mentioned, there are many patients and many confirmed cases in the last week or so. And there are also many patients coming to our hospitals, many through the accident emergency departments. So we do have a lot of patients in the A&E, and it's really a very crowded place at the moment. Because there are different patients at different stage of seeking help. Some just arrived, some has been seen by doctors, some waiting to be seen by doctors, and some waiting to be transferred to other facilities. So there are cases that may be temporary, have to arrange on temporary beds, stretchers, and different facilities. So to minimize this kind of situation, we adopt a multi-pronged approach. The adjustment of the discharge arrangement is one of them, very important measures, because we have to reserve our capabilities to take care of those patients who are most in need of a medical services. The other pronged approach, as the Secretary has mentioned, the government is now building more and more community facilities where elderly who are relatively stable can be sent to this kind of facilities to have care when the clinical condition permits. And also, I would like to echo the Director of Fire Service, Mr. Leung, just said, we would like to appeal to the public. Even if you are confirmed to have for example, rapid antigen test positive or COVID positive, if you do not have symptoms or very mild symptoms, please do not call the ambulance or come to the accident emergency department, because we have to reserve this kind of facilities and capability to take care of those who really need the service, who are more in need with more symptoms, etc. And also, as Dr. Lau has mentioned, we are now have opened 9 designated clinics for patients who have mild symptoms. If they still want to see a doctor, they can come to designated clinic. Currently, we are having 9 such clinics in operation. There are still capacities. And in anticipation of increasing demand, we will open more designated clinics starting from next week. To the end, we will have over 3,000 quoted per day. And of course, we'll continue to closely monitor the need and adjust accordingly.
下一條，呢邊第
Lady in green on the third row, Ming Pao. You talk about the isolation facilities and home quarantine, and that on days 6 and 7, if the person is, tested negative, they can leave. When will that come into effect? Secondly, for Dr. Koh, now recently, both inside and outside the A&E ward, there has been a serious overcrowding. In QE, we've seen patients lying on the floor. Has the Secretary seen those footages, and what is your comment and feelings about that? After changing the discharge criteria, would that be, a decision made too late? And also, what is the usage rate of these centers? The Secretary said that we cannot allow patients to be stuck outside of the A&E ward and staying in those tents. But indeed, we still have such tents outside the A&E wards. So how are you going to resolve this problem? When, at the soonest, will you be able to provide how many places to admit these patients? Finally, for the HA, you've changed the discharge criteria. How many people do you expect can be discharged? How many additional people can be discharged? By how much can the number of days patients will need to stay in the hospital? And also, have there been any cases where people die because of they suffer from the cold at the A&E ward? Dr. Koh will answer the question regarding the discharge criteria. The Secretary will answer the first question. Dr. Lam first. I'll repeat once more for clarity's sake. Now, for people who are waiting for hospital admission and for those who are under house or home quarantine, now, first of all, they will need to have to be vaccinated first, because if they are already vaccinated, the risk will be lower. For these people, if on day 6 and 7, after taking the test and they are found negative, then we have reasons to believe that the risk of their transmitting the disease further is relatively low. In that case, we can arrange for them to be discharged from home quarantine, and they don't need to be admitted to the hospital. However, as to how we can make the detailed arrangements, we will be making further announcements in due course. So we'll implement these measures once the details are announced. Regarding the overall anti-epidemic arrangements, one thing that is important is that we have a large number of cases and the transmission is, rampant. So whatever means we use to fight the epidemic, I think the overriding principle should be that we should reduce the number of serious cases. Now, therefore, we cannot allow some of our existing measures to stop us from lowering the number of serious cases, such that the hospital resources are subject to a lot of pressure. So after consulting many experts, including the use of RAT and also whether we can further compress the window time for quarantine. Anyway, the presiding principle is that whatever measures we adopt, we have to maintain the integrity of the public health system. That is the overriding principle. Dr. Koh, we believe that after adjusting the discharge criteria, this can help improve the turnover of patients who are discharged. Like I said, we've considered various factors and consulted many experts. Most importantly, we need to maintain the capacity of our public hospitals so that we are able to cater to the needs of the patients with serious illnesses. We see that the epidemic will continue for some time yet, and there will be more confirmed cases. So we need to prepare for that so that we have the capacity to admit more patients. After we've adjusted the discharge criteria and can that cut down on the number of days that hospitals stay in the hospital, I think the new arrangement will give us the flexibility when we decide on the question of patient discharge. Now, and many factors determine by how much you can cut down on the number of hospital stays. Now, if the number of cases remain at a higher level, there will be more people admitted to the hospital. With more and more cases, there will also be relatively more serious cases. And whether such patients will need to stay longer in the hospital, that is also possible. What we are seeing now is that we have a large number of patients, and once they're admitted, those who need to stay will definitely be those with more serious cases and the elderly, because for the elderly patients, it's not easy for the relatives to take care of them. Regarding the A&E ward, I don't have the latest figures to tell you how many of those patients have died in the A&E ward. But in the past, we've seen some cases where patients, when they come to the A&E, they immediately will need emergency treatment. In Hong Kong, the practice is that for such cases, we will always take, a viral test for these patients. So you may have cases which you don't see overseas, where in some cases, some patients already have certain diseases and they die because of that, and at the same time they're hit by the coronavirus. So the coronavirus may not be the cause of the death. So we will conduct detailed analysis to find out about these cases. To reiterate, when the patients come to our A&E ward, our colleagues will treat, like all patients, will make an assessment. And of course, if there are many people in the A&E ward, as you've seen the overcrowded situation there, this is of course not satisfactory. And of course, we will not be able to perform our observation and treatment as easily as before. And that's why we said we need to adopt a multi-pronged approach to reduce the overcrowdedness of our A&E ward so that we can better take care of these patients. The Secretary also said that we've adopted all these measures together with the community facilities to care for the elderly patients. Well, although they are in stable condition, they still need a lot of care. With more such facilities, it can help improve the turnover in our hospital system. So both patients with serious cases and mild symptoms are important. Also, like Mr. Leung, I'd like to make an appeal. We anticipate there will be more and more confirmed cases. Many people, after taking the RAT test, are still worried. But I'd like to make the appeal to the general public. That is, if you are tested positive with the RAT, but you don't have any symptoms, or if you only have mild symptoms, please don't call 999 or ask for an ambulance, because of more such people going to the A&E department, it will affect the operations of our ambulances and our A&D ward. We need to receive the capacity to care for those with a need. Some people may have mild symptoms and are still worried. Like Dr. Lau said, we now already have 9 designated clinics for persons or cases with mild symptoms who would like to seek medical, attention. There is capacity at the moment. Of course, you have to make a call first, but we have already arranged, starting from next week, we'll open more such clinics in different districts. There will be more than a quota of 3,000 places every day. I'm sure that we'll be able to cater to the needs of most people. And it's not just these clinics. Like Dr. Lam said, there are other supports available for those patients in need. So we'll closely monitor the situation.
Secretary, thank you. So you've heard the explanation from Dr. Koh and Dr. Lam. We're talking about the use of rapid tests and the situation of HA now. Now, every day, we see a rising number of cases. Given the magnitude and also the scope of these cases, we should very proactively contain the spread of the disease, and we must protect our healthcare system and to ensure that the most needy patients have the care they need. So we have 2 overarching principles. First, we must have triaging, and secondly, we must in a very focused manner contain the disease. So we have 4 tiers. First, hospital beds of the HA, whether we talk about the isolation wards in the first and second tiers of ward. And second, community treatment facilities for cases with mild symptoms or elderly patients that are relatively stable. They may not necessarily need hospital facilities. And the third tier, for better cases, we only need to isolate them. Younger patients or asymptomatic or patients with very mild symptoms, they will go to our community isolation facilities such as our Penny's Bay Quarantine Center, our public housing blocks, and our hotels. And the fourth tier is at home. I think many people would rather be isolated at home. And secondly, we have given very clear guidelines at home, whether you are asymptomatic or with mild symptoms or with acute symptoms. There can be different ways of handling these symptoms. As Dr. Koh said, we're going to expand our network of public health care system. Now, for people who are isolated at home and need they can go to not A&E departments, but designated clinics. And we're going to expand our network of designated clinics. We are short of hospital beds. The hospital authority has already announced that Tin Shui Wai Hospital will become a hospital solely for admitting COVID patients. So on the one hand, we increase the number of beds, we boost our capacity, but at the same time, we contain the spread of the disease in a more focused manner. And that's why we need RTD, we need CTN, we need more rapid tests. And lastly, we urge the public to fight the epidemic together with us. Hopefully, we can reduce circulation or flow of people in the community to make these measures effective. The last question, A&E department. The tents at A&E departments, there are still some tents because there is an inadequate space at A&E departments. Dr. Koh can explain. Because when people arrive at A&E departments, they have to be tested, and the tests may be administered inside tents. But our point is, hopefully, we won't have elderly patients or anyone staying overnight outdoors. And that's why we're now increasing respite centers. HA, or these holding centers. So as said by Dr. Koh, there may be patients, elderly patients with mild symptoms, but still they need care and attention. So we have a holding center in operation in Fuk Wing Road. And I also mentioned that at Shakib May Sports Stadium, we will have a similar holding center, and we're planning to set up more. Such centers will be able to help HA to relieve their overcrowdedness and also the backlog. On a daily basis, together with the Department of Health and HA, we will conduct an assessment of the current state of the epidemic and what measures will have to be adjusted under our multi-tier treatment facilities and also other measures. Now, Channel 32 of RTHK is now channel dedicated to this fight against the pandemic, and it can give you most updated information. Regarding the tents, I think I can tell you a bit more to enhance your understanding. At the early stage of the epidemic, we made available those tents because back then many people with symptoms or with a contact history were not sure whether they were a confirmed case, so they came for the test. We adopted tents in light of experience of other countries for better air circulation and to reduce the risk of cross-contamination. But then the number of tents may increase or reduce depending on the weather. Well, if it's too hot or too cold, it's not appropriate to have too many tents. And then for many people, they need a confirmation after doing the rapid test because they need confirmation to apply for sick leave from the companies. So after a rapid test, they may come for a test to confirm their status. So as a result, there was at one time a sudden surge in the number of patients. We were not able to absorb them. So we were in a difficult position. But as said by the Secretary, very soon a positive rapid test can be regarded as will be acceptable as a confirmed positive case. So very soon people won't have to come for a nucleic acid test to confirm whether they are positive. And we're gradually commissioning more and more community facilities. For instance, some elderly patients may not be able to return to elderly care homes upon discharge, and they can be taken care of in these facilities. We have also adjusted the discharge criteria. We urge the public to cooperate with us. We need your cooperation for a higher turnover of beds to relieve the burden on A&E departments, which is a very important element of our public health care system. A&E departments have to operate efficiently in order to take care of as many patients as possible. And I'm most grateful to our colleagues for maintaining service because the environment is very crowded. I have visited these places many times. I've discussed with our staff what to do, and we're grateful to members of the public for the understanding. It is understandable that some patients might be a bit fidgety or agitated, but most of them are very understanding. I think it's important at this time that we are more accommodating towards one another.
Last question, the lady in the third row. I like the confirmed cases who died in Yan Chai Hospital. How many elderly patients have died in the A&E ward? Some doctors say that many of those who passed away, well, the hospital authority was not able to be attended to before they died. Do we have such a similar situation in other hospitals? And will you consider collaboration between public and private hospitals to admit such patients in order to minimize the fatalities? And also, is the epidemic now getting out of control? How would you define whether or not it's out of control? And thirdly, last night you announced the amendment to your testing policy. Many people, many of the staff at the testing station are not aware of that amendment. Many people have queued up to take the R&T, and there is a confusion there. So for such important change in your policy, why is it the government only issue a press release without even announcing the date of it will come into effect? If people take the RAT test and don't volunteer to report, would that be a violation of the rules? And what's the purpose of such report in that case? The Secretary will answer the question. Let me talk about collaboration with private hospitals. First of all, I think we've been in close liaison with the private hospitals in recent days, and we have had very good progress. Overall, we have arranged with different private hospitals and made arrangements for 120 beds, which can admit patients in stable conditions. More than 50 patients today have been sent from different public hospitals to these private hospitals. We are also talking to the private hospitals, and we are about to implement arrangements for young children who are more urgent cases. They can also be referred to the private hospitals. Once it is finalized, we will announce the details. Regarding the patients who passed away, over the last 24 hours, 66 COVID patients have passed away, most of which are elderly patients, except for a few who are relatively younger. But these younger patients also stayed in hostels or homes and have suffered from chronic diseases and needed to be taken care of. Among those who passed away, most of them had not taken the vaccine. And this goes to show that vaccination is very important. Also, because of the time lag in the submission of data, we have 12 patients who died earlier, which have not been reported. But again, most of them are elderly patients and patients with chronic diseases. Secretary, to answer your second and third question, I'll try to answer your question in Cantonese. First of all, our judgment regarding the state of the epidemic. I think Dr. Lam had said just now that the situation now is very serious. And secondly, according to Dr. Choi, the number of cases are still increasing. The overall trend is that the number is still rising, and we have yet to see the peak. And it's likely that the number of cases will go up further. Thirdly, our focus in respect of containing the epidemic. I said that our principle is that, first of all, we need to reserve capacity in our public health system so that it will be able to, admit the right patients. We need to reserve our resources in our public hospitals to serve those with the greatest need. So two strategies here. First of all, we need to provide, different levels of treatment. We need to adopt a targeted approach to intercept the transmission. Other than the press release yesterday regarding the change in our testing strategy, this is part of our targeted interception measure. On the one hand, we need to step up our effort in RTD. RTD actually could be done within a day. So within a very short time, we can actually identify the confirmed cases and isolate them. And secondly, we need to fight against time. So the normal compulsory CTN will now be changed to RAT so that we'll be able to more quickly, find out the results and people don't have to queue up. We hope to be expedient and to be able to identify the cases as soon as possible. The third adjustment to our strategy is that for people who are exposed to higher risk, they are already taking the PCR test. That will not change, but the test should be taken once every 7 days rather than 2 to 3 days. But during the interim, we've also added the RAT test requirement. This is another way to achieve early identification or detection. Waiving the confirmation requirement is part of the package to help us expedite the treatment. I think further details will be announced as soon as possible. I have today explained to you our overall strategy. Regarding treatment at different levels, other than reserving available hospital authorities to serve those with the greatest need, other facilities like the community treatment facilities, the community isolation facilities, and our home quarantine and isolation arrangements, we have a system and a plan in place. And this arrangement, I think with this group of patients, as the number of such patients go up, because for the Omicron virus, normally the patients would have mild symptoms. So people who need to be treated at home should be very large in number. The HA also said that they will be increasing the number of designated clinics and the number of beds in hospitals. I think the tertiary hospital will be converted into a hospital which will solely treat COVID patients. So with the increase in our facilities and with our different strategies to contain the epidemic, I think we will continue with these efforts. I would like to take the time here to thank our frontline medical staff, whether it's the A&E ward or those colleagues working in different wards and other facilities. The state of the epidemic now shows that our frontline colleagues are really working very hard, so I'd like to really thank them for the dedication. In these difficult times, I hope that we can stand united, and as far as the government, we will implement our measures and strategies. Thank you. I think that's the end of our press briefing. Thank you very much.